we had a further report and study, and this is an organisation called Suffolk Health Watch, and basically they're very concerned as to what and how, where support etc. is coming for the, I think it's 7.8 million of us who are on elective surgery but not yet. And I must declare an interest. I'm one of those. I've been fortunate. My consultant has been in contact and given me some idea of what and when and what I need to be doing, and that is reassuring, and that's a lot of people actually. I think it's sort of, is that 1 in 5, 1 in 10? Yeah, I think it's 1 in 10, isn't it? That is a lot of folk. So there were a number of questions done by Health Watch Suffolk, and I think it led that organisation within itself to question and see the need for a greater and better survey. And this was done through the auspices of our existing general hospitals. So there was a lot of collaboration on that, and quite a lot of things came out of the survey that was done. But the thing that really concerned me greatly, it was access to support whilst patients are waiting, and it was sort of information on the treatment itself, information on its condition. About half of the folk who were surveyed thought that they were reasonably well informed in that particular area. What was really concerning was when you get down towards the bottom of the chart, in things like mental health support, emotional and social support, help from social care services, and even more surprisingly support from charities or community groups. The figures for that was in the low units. Mental health was sort of 7%, emotional social was 5%, help from social services was 4%, and support for charities and community groups was but 2% of those of us that are sat waiting for our elected surgery to go forward, or whatever the care that's going to be delivered will be delivered. And it is rather worrying that there are charitable groups that exist specifically for stroke, for heart attack, for mental well-being such as mind, etc., etc. And you, the patient, or friend of the patient, or whatever, seem to be unaware of their existence and how you could actually get some support whilst your nearest and dearest is waiting for whatever procedure has been delayed, deferred. And bearing in mind it's such a large number, I would stress it would really be in your own self-interest for you and your relative to perhaps check with the GP service or your consultant or the hospital or whoever, and find out what charitable groups exist in the area that could actually help take the load and help your relative. So, a further update in a couple of months' time when the Suffolk Health and Wellbeing Board meets again. Cheers for now, stay healthy, bye.